Hello, everybody. Dr. Mark Di Pasquale here from Adjusted Chiropractic. You may be listening to this from our local community. You may be listening to this from around Australia or even around the world. Wherever you are, one of the things that we like doing is actually bringing up research articles to the community to make sense of them, to explain them, because a lot of the questions we get from our patients and also from the local community is like, how is this possible? How does chiropractic work? What is chiropractic? So a lot of these articles, we pull them apart and just make sense of what's actually going on when we do have patients who come up with remarkable results. And then we want to make sure we understand why they are, why the results come, what time frames they come in, what factors affect them, so that we can understand a little bit more of how to look after our health. So first of all, this is the article that I'm going through today. It was published in the Annals of Vertebral Subluxation Research in January 16, 2024, so a couple of weeks ago now. Its title is Reduction of Upper Back Pain and Resolution of Sciatica Following Chiropractic Care to Reduce Vertebral Subluxation in a 30-year-old female with scoliosis. It's a case study on this patient. So first of all, I think that title is a little bit loaded with regards to a lot of information, or probably too much information. First of all, reduction of upper back pain and resolution of sciatica. So they've obviously honed in on some obvious symptoms or problems that this lady was having at the time. I would much have preferred, definitely like articles and research which go straight to the vertebral subluxation and the assessment of the vertebral subluxation, because sometimes when we have upper back pain or sciatica, which effectively is compression on the nerves coming out of the lower part of the spine, or it could be coming out through the hip or through the muscles of the hip and the pelvis or down into the leg. Us as chiropractors, we need to determine whether it is due to a subluxation or not. Sometimes it is, sometimes it's not. So that's our job, to find out whether the nervous system of a person is working correctly. Now, what I mean by the nervous system, and those who are watching this, if you haven't heard of a vertebral subluxation, what a vertebral subluxation is, if you can picture the spine, and our spine is made up of 24 individual vertebrae. They're all sitting on top of each other, and the spinal cord sits inside the spine, and then we have nerves which come out at every level. They're called nerve roots. Now, in the sides of the spine, there are small holes where the nerves come out. If those holes are narrowed, and those holes are narrowed so much that they irritate the nerves coming out of the spine, they can push on them, rub on them, irritate them, whatever you want to call it. It just means that the nerves can't function correctly, or they can't get the messages out those nerves correctly to wherever they're going. Then that affects the way that the nervous system functions. And the theory is, if you affect the way the nervous system functions, you effectively affect the way that person will function, or wherever that nerve will be going, and also the information coming back in through that nerve to the central core, or the cord, and then up into the brain, will be affected. Now, what type of nerve transmission will be affected? The nerve impulses can be slowed, they can be quickened, they can be changed. It basically, to keep this simple, it's just different from what the body would normally be doing if there wasn't any irritation on that nerve. So, we try and keep that very simple. And ideally, the concept of chiropractic and the concept of looking after one's spine and working correctly is quite a simple concept. And that's why it gets such great results, and that's why it works so well. So we're looking at the results of this study here, in that, yes, the upper back pain did resolve, the sciatica did resolve. So obviously there is some nerve involvement there. Now, looking a bit deeper here, we find levels of subluxation at the C2, which is the second vertebra down in the neck. The upper neck is a very common place for nerves to become irritated in the neck, because we're always moving around, our head and our neck, and a lot of issues can come from there. T6, which is in the middle part of our back, down lower, and then the right ilium, which basically is part of our pelvic pelvis alignment, sacrum iliums. So So what I don't like doing is when I read these articles is I don't like going specifically to say, oh yeah, so obviously an upper back pain problem, or if someone comes in and sees me with upper back pain, oh, I'm going to go straight and look at their T6 and see whether that's a problem. That's not really the way chiropractic really should be done. It should be done that the entire spine is looked at all the way from the very top, all the way down to the bottom. Wherever there are these subluxations or misalignments, and they could be compressing on the nerves coming out of the spine, we want to reduce them, whether they are causing problems or they're not. Generally, the reason why that is because sometimes with subluxations, when we first get them, they can cause us, sometimes they can give us signs that they're there. They can give us pain, they can give us problems, etc. But then, so that's the warning sign. And if that's ignored over time, then sometimes the nervous system or the brain can say, okay, we're not getting any help here. We're just going to dull that pain down. So therefore the pain, it can actually, the body can quite cleverly take the pain away. So it just sits there under the surface. And in times where there's excess stress, or we might be, doing certain things, or who knows what it could be, it then sort of comes to the surface and lets us know again. And that's where a problem sort of comes back, goes away, comes back, goes away. So our role, once again, is to check the entire spine, make sure there aren't any subluxations, and make sure the nervous system is working correctly for things to work well and to continue working well. Now, the reason why we want to do that is because um, this article goes into it just basically tells us about how upper back pain and how sciatica resolves with regards to the chiropractic care, but it didn't necessarily get into any in-depth other changes or processes that the body changed going through the process of adjustments and the body working differently, nervous system working differently. Because in many cases, someone will come in for a certain problem, but then they'll get help through chiropractic care, and they'll find that other things will improve. And that's because the nervous system controls the whole body. So I'm very interested to see, and there is a, if I just move across to there's a news release that has come here. And this release is saying it does dive into it a little bit with regards to how the power of chiropractic adjustments, and then looking ahead, explains that the nervous system will be working better, and therefore, we can perceivably not be surprised by any other changes or improvements. Now, the reason why I say that is because, especially with the resolution of the sciatic pain, the sciatic nerve is a large cluster of nerves which comes out of the lower part of the spine, and it makes the sciatic nerve, and then that goes down into the legs, and then they branch off to create other nerves which go down into the lower legs, feet. Now, if this has been improved, well, then we would expect that the nerves coming out of the spine, now they also go to supply other things too. They supply organs, they supply, many, many different things, but definitely with regards to organ supply, that in theory, that should improve too, shouldn't it? So who's to say what other changes can be made in a case like this with regards to improved function of the nervous system? And that's really where chiropractic comes into its own, because this is where a lot of people are amazed by the benefits they get out of chiropractic care, that it can help with the body's healing ability, etc. And then also it can help with how the body normally functions, or how it should normally function, how it's designed to function. I'm not going to get too technical about that, but effectively, if the body can heal itself, that's how it's made. And when it's unable to heal itself, or when there's a problem that hangs around, whether it be a health issue or even a disease or a bacteria or something like that, the body's resistance isn't high enough to take care of that, whatever it is, and then it continues to succumb. So chiropractic care is about getting the body's resistance up, getting the nervous system working correctly, making sure that the body does heal itself, regulate itself well. So when it is challenged by something, it could be challenged by a bacteria, a virus, an injury, something, it can actually heal the cells and move forward after that. So So with regards to this outcome here, quite a good outcome with regards to this 30-year-old female. Quite a basic um, case study, one that we hear of many, many times. Many people come into our practice and they come with issues, and then we check their spine, check their nervous system, get it working correctly, and then over a period of time they just improve and then move forward and go on. One of the things that we don't see in this case study is the aftercare. So we see a course of adjustments, we see a program of adjustments over 6 weeks, and then we see a follow-up course of adjustments for a following 6 weeks. So that's 12 weeks in total, so that's 3 months. There's no indication of what aftercare is there. So effectively what that means is if we have seen that in a case, checking the spine, making sure it's working correctly, um, um, making sure that the nerves are able to come out correctly, making sure there's no irritation on any of the nerves, the body recovers, it gets rid of these original problems that it has. How then is that maintained? Like, how do we maintain the spine in a healthy alignment, working correctly, strong, all the muscles and ligaments strong, stabilizing it, just so that any of those holes where the nerves come out don't pinch down on those nerves again and start to create either similar problems or other problems into the future. And generally, general checks of the spine and the nervous system can be done to make sure that that isn't occurring. And if it is occurring, it's corrected, and then we move on. So another final thing I do want to pay attention to here is with regards to the indication of scoliosis, because in the media release, basically it goes straight to term scoliosis pretty much as the problem here, or the main problem in this case. Look, I don't think that's entirely the case. The scoliosis is where the spine has incorrect curvatures in the spine. Now, really, scoliosis, effectively, if vertebrae are sitting on top of each other, if a scoliosis is curving the spine, all we need to be doing is looking at the holes, once again, where the nerves are coming out. If they are getting irritated coming out of those nerves, either on one side or the other, then we need to make sure that the scoliosis is reducing, because it's the alignment of the vertebra that will be causing this. Now, so I don't really like the idea of scoliosis as a diagnosis, because generally even healthy spines can have slight scoliosis in them. It's not affecting the nerves. The spine can still be strong, it can still be healthy, it still can be functioning correctly, and the person's body's ability to function well, heal, regulate everything, be strong, and work properly is there. So that's not something that would need to be corrected. So these are individual cases that need to be looked at individually and taken care of individually. So it's not a matter of saying, oh, one person has a scoliosis, so we need to look after it this way. Another person is more or less, so they need to be looked after that way. It's very individual cases with regards to chiropractic care, and effectively going back into how the nervous system is working, how their brain is functioning, and how the brain and the body are taking care of themselves, and how they're communicating with each other. So there's a bit of an explanation of that article there. If you do want any more information about the article, you can go to the full article and read it. It's pretty straightforward. If you do have any questions about anything that I've spoken about, anything with regards to any areas of the spine, nerves such as sciatica, any things that can affect the spine such as scoliosis, etc., or you've got any questions about subluxation, what it is, what it does, what caused them, etc., please just give me drop me an email, and I can explain those. So there you have it. Cool article, cool results for this person. Congratulations to her. All right. Bye, everybody.